Anamika Joshi. I'm an oculoplasty specialist, that is an eye plastic surgeon or an eyelid specialist practicing in Hyderabad. So today I'll be talking about a very common condition, that is cysts or moles around the eye. So now cysts or moles or tumors around the eye are very common. You must have seen small blackish things or whitish things around the eye of so many patients. Now these are usually harmless, but it is important to understand that sometimes they can be dangerous also. So a few benign ones, that means non-dangerous ones, could be congenital nevus, that is a mole around the eye, which can be present onto the skin of eyelids, or it can also be at the eyelid margin. When it is at the eyelid margin, the removal of such a mole becomes a very specialized job. Then coming to the cysts can be of different types. They could be epithelial cyst, they could be tarsal cyst, epitarsal cyst, based on which tissue is the cyst arising from, which gland is it arising from. So such cysts can also occur in any region of the eyelid. Sometimes they can be very close to the tear duct of the eye. In that case, their removal can also become a little more specialized. Also, sometimes there could be smaller other type of lesions, which could be vascular lesions, and rarely there could also be cancerous lesions. Yes, you heard it right. Cancer can also be present in the eyelid in the form of a swelling that can appear. Now, one thing you need to understand is that the size of the lesion is not the determinant whether it is dangerous or not. I have seen very small lesions being cancerous, and I have seen big cysts not being cancerous. So you need to understand that even if you have a small swelling, you need to visit an oculoplasty surgeon to understand whether it is a harmless lesion or it is a harmful malignant cancerous lesion. So, how do we treat these conditions usually? First thing, as I told you, we determine whether it is a benign lesion or it is a cancerous lesion. Now, if it's a benign lesion and it's growing in size, it is better to remove it. That means we do excision biopsy or cyst excision or mole excision of that lesion. If the cyst is a benign lesion but it's not really growing in size, then we can observe it also. Usually 6 monthly observation with photographic documentation is what is advocated. Now, if it's a malignant lesion, that means there is some cancer that is growing, then we need to remove it with wide excision. That means we need to remove some margins also, some adjoining tissue also, so that we make that area completely cancer free. And based on the size of the defect that is created after removing the lesion and the adjoining area, we do reconstruction of these lesions. So this is a very specialized area and it is best handled by oculoplasty surgeons. If you have any such lesion, you need to visit an oculoplasty surgeon, especially if it's growing in size gradually. Sometimes the cysts can be very big, and even benign cysts, removing them could be a tough job. So it is better not to wait for them to grow big, and even when they are small, you should visit an oculoplasty surgeon to at least understand what type of lesion is it. Does it really require removal at the same time, or can you wait? Usually these surgeries are done under local anesthesia. They do not have any risk to the body, and after if it's a small cyst, usually it just takes 30 minutes for the procedure or sometimes even lesser. If it's malignant which requires reconstructions, sometimes you can have 2 stages of surgeries also. So the surgery completely depends on what it is, where is it involving the eyelid margin, is it involving the tear duct, how big is the lesion, which area is it involving, and such factors. So if you have a cyst, please visit an oculoplasty surgeon. If you have any such lesion, don't ignore them and take a consultation. Thank you.